Glad to tell you that we are, FRC, we are on the ground for the week-long World Health Assembly that's underway in Geneva, Switzerland. Officially got kicked off yesterday, and as we're hearing, as of this point, the headlines so far mostly have covered the failure of the World Health Organization to build consensus for its proposed pandemic treaty.
We all wish that we had been able to reach a consensus on the agreement in time for this health assembly and cross the finish line. But I remain confident that you still will, because where there is a will, there is a way.
All right, well, that was WHO Director General, Dr. Tedros Ghebreyesus, who's giving his opening remarks yesterday. But there appears to have been enough disagreement among some countries about the text of the agreement that it's almost certainly going to be postponed. The question is for how long and what can we do about it? And given these developments, what should we be watching for during this coming week? Well, joining me now from Geneva, FRC's own policy editor for the Washington Stand, Travis Weber. He's also Vice President for Policy and Government Affairs at FRC. He'll actually be on the program daily this week with updates from the World Health Assembly and also providing some regular updates at the Washington Stand. So for your benefit, if you'd like some additional reports and photos and other media that Travis will be able to provide this week, you can catch it all by going to frcaction.org/who. Or you can simply text the word WHO to 67742. All right, Travis, great to see you. Thanks for staying up late.
Thank you, Jody. Good to be with you on the program.
Well, listen, let's just begin an overall glimpse of what you've seen so far, particularly regarding the pandemic treaty. What's it looking like?
Yeah, so that is the big topic of focus this week. And the World Health Assembly meets annually to conduct the business of the World Health Organization. And oftentimes the proceedings are administrative, do not get a lot of attention. And so, there's a shift this year towards the pandemic preparedness agreement that a lot of people are tracking, a lot of people are monitoring, and there's a lot of interest in, alongside of the amendments to the international health regulations, which have been around several decades, but are now under consideration for amendment after the COVID-19 pandemic. And so those two areas of policy are the two areas of focus. However, there's a lot more that's happening at the World Health Assembly concerning the business of this global institution. And so, we'll want to update folks on everything going on. But certainly, if we're looking at the status of the pandemic agreement right now, there was not a consensus reached, or there was not an agreement reached on the agreement. There was not agreement reached on the text before the start of this World Health Assembly. And so they do not have a common text to operate from at this point. And so the member states of the WHO are considering how to proceed in light of that. That's still yet to be determined. And there's some discussion here the last couple of days in some of the committee meetings about how to proceed. And so it's likely we could see some sort of determination from the WHO that member states agree to, or it's put to a vote about how to proceed with future consideration of the pandemic agreement. In addition, the international health regulations are under consideration here as well, and we might see some amendments that are moved ahead and considered by the full World Health Assembly towards the end of this week. And so these two areas, there's a lot yet to be done, to be determined. So far, there's not yet been agreement reached for several reasons. Primarily the inability of nations of the world to agree on how to share their resources and how to share their the development of vaccines, intellectual property, and the resources that each nation develops, how willing they are to hand that over to the World Health Organization or distribute it globally. And so these are still items that are yet to be determined. A lot more happening this week, and if folks can go to that Washington Stand page. That's washingtonstand.com/WHO for more information.
Well, it sounds like obviously there's a lot going on and a lot at stake on so many fronts. It's amazing that they're really getting started on the wrong foot without even having the capacity to get a consensus. It seems to me, and I'm sure it's much more complicated than my simple mind comprehends, but it seems to me that these are issues that should have been resolved before the Assembly ever even got together. But nonetheless, in his opening remarks yesterday, the WHO Director General continued to blame misinformation as a major obstacle. I want to play a brief clip here for you, Travis, and then get your comments as to what is he referring to with misinformation. Play clip 3, please.
I ask you to chart a path forward for the pandemic agreement and the IHR amendments so we can bring both to a conclusion as soon as possible. I ask all of you, governments, partners, civil society, youth organizations, to speak up for the agreement and speak out against misinformation.
Right, he doesn't define misinformation. What is he talking about here?
Yeah, I mean, Jody, we don't know exactly because the terms are vague. And I think at times they might be deliberately left vague in order to allow for maneuvering room by those who wish to use these terms and definitions at some point. Certainly this topic the topic of misinformation, the idea of misinformation has been tossed around a lot. It's been in some of the drafts of the pandemic agreement. Now it still was left in the preamble of one of the drafts more recently. But it only breeds more public distrust when people are not able to fully share their concerns and air their grievances. And the people of the world need to be heard. And the people of the United States need to be heard in terms of their concerns about the WHO, about the way the COVID-19 pandemic was handled, about the way any of their health information might be distributed or shared or given over to some government program that they're unaware of. So, number one, people's voices need to be heard. They need to be listened to. Number two, the governments of the world who want to agree to this really need to do a better job of explaining it to their people and to be saying, look, here's what we'd like to do, and here's why we'd like to do it. People still might disagree, but at least then things would be more in the light than they are now. Part of the problem with what we have right now here, the current status of this agreement, is the way it is appeared to have been done in the darkness. So I think at a minimum, we need to air things out, put them in the light. And that's also a telling sign if people don't want to do that. If governments don't want to do it and leaders don't want to do it, what are they hiding? It should be no-brainer to air out and explain to your own citizens what you are looking to do by entering into a pandemic preparedness agreement and what you are willing to do as a government, of national government, in entering into amendments to the international health regulations. You cannot explain what and why you want to make those changes. You need to stop right there and really ask why there's an inability to explain. I think also if we do that, it's going to go a long way to at least solving some of the problem here. People still might disagree, but at least then things would be out in the open. Part of this misinformation crackdown, to put it that way, is it's an attempt to suppress the conversation instead of having the conversation and then saying, look, we've had one, we may disagree, but at least we've had the conversation. We can't be suppressing those conversations. It's only going to breed more distrust, breed more fracturing, and breed more disunity. And I think part of the way ahead on some of these issues is to have more of those conversations.
Sounds very similar to what some things that we're experiencing here in the United States. So the claims of misinformation coming, basically referring to and meaning anything that disagrees with us, us being those who are in charge. But there's no wonder that they've failed to get consensus when they put so much of this together in the dark behind closed doors and then just springing on everyone. But given the failure to build a consensus, what are you hearing, Travis, from the participants that you're speaking with, and what do you anticipate going forward? I know you said that there's a lot of different options, but what are you hearing, and what do you anticipate is going to be the outcome this week?
Yeah, so Jody, as I was observing the plenary sessions in the main room in which the delegates there were two delegates representing each member state in a circular formation around this room, in which the president, the presiding officer of the World Health Assembly, the director general, and other leaders are up front. That's a room in which the nations who are member states of the WHO come together and share their remarks, their perspectives with the general body of the World Health Assembly as it's coming together to discuss a number of topics, right? So you have a lot of there were a lot of short speeches, a number of different topics. Certainly, some themes emerged there. We could go into some of those and explore some of those, but it was actually quite eye-opening to see how some of these themes were emerging. It would not be automatically, necessarily understandable why they are emerging at the World Health Organization. Themes like a targeting and focus on condemning Israel for its activity in the Gaza Strip. Some nations would make an attempt to link that to healthcare. Some didn't even try to do that. And they're just standing there making speeches about Israel. And this is the World Health Organization, the World Health Assembly. In theory, they're supposed to be coming together to try to solve health concerns, but you see a kind of world table of power players, each looking to push their perspective, advance their perspective by making speeches. So that struck me as quite odd, honestly, being in that room and hearing the speeches of member states. I think, Jody, to get to your question about kind of where are we going, what's the sense of states, you've got a number of member states here who are small, poor states, and understandably they want, and in some ways may need the help of more well-off, advanced countries in solving health crises in their countries. Some of these things are not new. Issues like malaria in Africa and other diseases for which there back then vaccines developed, routine healthcare issues that are plaguing populations of some of these countries. We have to understand this discussion and this meeting in that context, because these issues have been going on for a long time, despite the more recent emergence of the COVID pandemic, the response to COVID, the concerns and issues around that, and now the subsequent attempt to amend the health regulations, which had been around before COVID, and institute a new agreement or treaty dealing with pandemics post-COVID, right? So in that context, we have to look at those concerns and understand that many nations are trying to look out for the interests of their citizens in some way. The question is whether whatever solutions are arrived at will actually help those citizens with better health outcomes and with solving, in some cases, issues that are life-threatening. The other thing to keep in mind is that some of these nations come from a very different governance perspective than the United States. The United States, there's a tradition of government from of distribution to individuals, to families, to local communities, and only in bigger issues, in theory, is the federal government supposed to get involved. Certainly, constitutionally, there are areas enumerated to the federal government under our Constitution, and if they're not there, the issue, in theory, should be left to the states. And we have a philosophy of government going back to our founding, which depends on a self-governing moral and religious people. So this really sets the stage for people in the United States to say, why should the federal government be tackling XYZ issue in the first place? A lot of these countries may come from a different, and they do come from a different governance perspective. And in the United States, healthcare is a matter left to the states under the Constitution. And in other countries, they might have a culture or a governance system, a legal structure that says the federal government it's normal to look to the federal government and the central government to deal with these concerns and these problems. So you really see that emerging, where these world leaders show up at a meeting like this and they come around the table and they say, how can we solve the problems of our citizens? And I look at that and think, well, it's hold up, because in the United States, we don't necessarily think that way. That's just important to understand as we look at a conversation like this, because the conversation will be happening. The nations of the world have and will always find a way to come together. The question is not that. The question is whether the mechanism and the way in which they're coming together, in this case, the World Health Organization and the Assembly, and a specific mechanism like the pandemic agreement, is the necessary, proper, and right approach for them to come together. Certainly, that's under dispute at a minimum. And I think there are a number of concerns about that a number of nations share. And so I think, we're going to see continued discussion over whether and how resources shall be distributed or shared between countries. Some of the African states are objecting to the language that is some are attempting to put into these agreements about sexual and reproductive rights and the inclusion of these ideologies that go against their cultural values and could be interpreted to be part of any such agreement when terms are interpreted.
We're going to have to wrap it up there, Travis.
They're objecting to that.
Travis Weber, policy editor for Washington Stand and vice president for policy and government affairs here at FRC. For more info to stay on touch of what Travis is finding, WashingtonStand.org/who.